Hello, Dr. James Bogash, expert in health and longevity, and kind of really interesting study today from a variety of different standpoints. And it has everything to do with diabetic neuropathy being treated with alpha lipoic acid, and which is a pretty powerful antioxidant, and what happened to the people who were taking it. So let's start with diabetic neuropathy. Pretty much sucks, and the general approach from medicine is in this study they call it symptomatic treatment. In other words, you're not fixing anything, you're just keeping the symptoms at bay. Like things like Cymbalta, Lyrica, gabapentin, those are medications that they'll help to use for those. In general, sometimes they seem to help, but the big thing here is they call it symptomatic. It's not fixing the problem. This same group of people, this study was done out of Hungary. They use alpha lipoic acid and they describe it as pathogenic treatment. In other words, we're using a compound to fix the problem, not just cover up symptoms. Certainly sounds like that would make more sense, right? And symptomatic treatment isn't going to fix anything else that might be associated with the diabetes or the diabetic neuropathy, but that alpha lipoic acid potentially could. So that certainly makes sense, and getting to the root of the problem is always the most important factor. So a couple things as far as alpha lipoic acid. It can be produced inside the mitochondria, but it's a really potent antioxidant. Also improves glucose sensitivity, so being used in diabetics makes sense. And also increases something called nitric oxide production, which I talked about a lot, which is generally very good for the blood vessels and potentially for the nerves. So all in all, a pretty good supplement. It's been used like for liver failure, it's been used for a lot of things, but in Hungary, it's considered a standard treatment to be used for diabetic neuropathy. So they looked at the people who got the symptomatic treatment versus the pathogenic treatment and what their outcomes were over the course of the study. And they found that those who used the alpha lipoic acid were 27% lower to suffer a acute heart attack, 29% less likely to suffer a stroke, 28% less likely to be hospitalized for heart failure, 17% lower risk of cancer, and all-cause mortality, the likelihood of dying from anything, was 45% lower. This is what happens when you look at fixing the problem versus just symptoms, is that you're going to get better outcomes all over. Combine that with exercise and diet and everything to lower A1C, and that would be the beautiful picture. But for a single supplement being used to have this kind of an impact is really pretty impressive. So as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.